Hey, strong, sexy mamas. I am about 9 months pregnant right now, and before this belly goes, I wanted to offer you some prenatal doctor fitness tips with my friend Dr. Jill Gamberg. How are you?
Great. Thanks for having me.
Fantastic. So Jill has done some interviews with us in the past. You also may recognize her from some of the Strong Sexy Mamas workouts. You're one of us strong, sexy mamas, hey?
Yeah, great workouts.
And has done the postnatal fitness tips with when Brooks was about 6 months old or so. So here we go. Let's get started on the prenatal fitness tips from a doctor's perspective. So obviously, I'm a huge advocate of fitness all day, every day, not really, but I like in Strong Sexy Mamas for prenatal women to be in a moderate intensity zone and to work out with me almost every day if they can. What is recommended? What do you recommend?
Certainly working out every day is what's recommended, but you want to only make sure to do a moderate intensity, as you said.
Okay.
And no more than about 30 minutes daily. You don't have to do every day. If you feel like you want to and you're feeling well and you don't have any issues or injuries, then by all means, every day of the week, 30 minutes is what the recommendation is.
Okay, so what about somebody who was doing 45 minutes or an hour of exercise before, or somebody who was doing 10 minutes or 0 to 10 minutes before they fell pregnant? Where should they be?
Yeah, good question. I mean, you should always sort of continue with where you're at. And so if you didn't exercise previously, taking up new exercise is always best to start slowly and lightly, as in lower intensity.
Yeah.
If for the people that are very elite athletes or very experienced in exercise, you can do longer times than 30 minutes, but you still need to modify what you do in terms of intensity, how heavy you lift, those kind of things. So it's important to modify and be careful with your body as it changes in pregnancy.
Yeah. But I love how the recommendations have changed from when our moms gave birth to us, and it was more, you should be on the couch, or you can do a light little gentle walk, but it's more than that now, isn't it? What are the benefits of exercise for a prenatal woman and for baby, for that matter?
I think what's clear is since our moms were pregnant to now, the research has shown the benefits to mom and baby are so many and numerous. We can't even name them all here.
Yes.
But things like, which is why we're encouraging women to exercise safely in pregnancy and after. But things like boosted mood, increase in energy, increased muscle strength, cardiovascular fitness, pelvic floor strength, abdominal strength. What else? There's so many.
What about the benefits for baby and the size of baby?
Well, the baby will take what it needs, but as long as the mummy's healthy, then the baby will take what it needs, and it will leave mummy with also some extra goods for herself.
Yeah. I have to say, I've had several friends and just women say to me, oh, you know what, I'm pregnant, I don't want to do anything right now, I'm going to take things up, after I get my 6-week check, or when baby's 6 months old, or whatever. And really, your postpartum recovery starts in the prenatal period. What does that mean?
Well, some other benefits that it's good that you mentioned is preparation for labor and delivery, which, let's face it, is a pretty difficult thing to go through.
Yes, it's going to be me in a couple weeks.
Yeah, but you're a strong woman and you're ready, and that's the important key. It helps improve your body, so the stronger and more healthy you are before you do go through the labor and delivery, the more ready you are to take that head on.
Yeah.
In the same respect, if people say that they want to wait until after they give birth, I mean, we've talked about this. I think that there's a bit of a misconception out there that as soon as you finish your 6-week check, you can just go back to everything. Well, in fact, that's not the case.
No.
And so it really does show that having a baby is like any other medical procedure or operation. You need to get over it. You need to do that safely. You need to heal, and getting yourself as in good shape as you can while you're pregnant to prepare yourself for that recovery time helps you then take up exercise after at a higher level, more safely. But even that takes time.
Yeah, well, and we have these postural deviations, don't we, where we get lordotic because our belly is here, or we get kyphotic, rounded shoulders from the nursing and breastfeeding, and just from gravity, from sitting all the time. So the exercises, especially if you do my postural foundation workouts, and really I mix posture exercises into pretty much every full body workout as well. But that can help with pain in the postpartum period too, can't it? I mean, in tight muscles and all kinds of niggles we get from our center of gravity changing.
Absolutely. And so, like you said, the center of gravity, you really start to get more heavy in the front. And what that does is change the way your pelvis and your back sits and your upper back. And so you really start to, your body always tries to right itself in space, and it gets confused when this growing weight is in the front. Otherwise you walk around like this, right? So you kind of have to stick your belly out and bend your back a bit more lordotic and curve your shoulders in to kind of right your center of gravity. But in fact, that can cause injury in itself. And so just like you said, concentrating on safe exercise that promotes good posture can also help deal with postural issues when you have the baby, which tend to be very slumped over position. We're holding the baby. Even if you have a couple, you're wrestling one baby in your hand, running after the toddler. You tend to be always very rolled in with the shoulders, and that can cause a lot of pain in the upper back and the neck. So there's lots of reasons to be in good shape while you're pregnant.
Yeah, stick with Strong Sexy Mamas. We'll get you all in proper alignment before you move on to the harder exercises. We also hear, it's written everywhere, our doctors tell us to stay away from exercises that involve, contact sports or a risk of falling. But I have women often ask me, well, I'm a snow skier and I'm only in my first trimester, or I'm only going to be early in my second trimester. Is that okay? Or I love to cycle. Is this okay? Or is this something that, you're just weighing your risks, or what is it?
Look, everybody's different, and I think it's important that you have the conversation with your doctor. But my feeling and what I recommend to my patients is that anything high risk, such as something where you could lose your balance and fall off, would be dangerous. So like road cycling, skiing is really fun, but it's not the best activity to do when you're pregnant, because you could fall and hurt yourself, hurt the baby. And so just things like that, and contact sports are really not the best idea, like football or riding a horse, or you just have to be reasonable. And I guess, again, it's a discussion, but why can't you just take 9 months and take care of your body and take care of your baby, and then you can go back to all the stuff, more risky stuff that you wanted to do later on. So I think it's just about weighing your risks and making safe decisions for yourself and your baby in your pregnancy.
Right. Also, we're told not to overheat, and that includes not going to the sauna and the hot tub and hot yoga and hot Pilates. Why is that? Why is it that we don't want to let our body temperature go up too much?
There's a couple of reasons. There's been some research to show that overheating your body in the first trimester can actually be dangerous to the baby. So we never recommend that. And obviously no one would want to harm their baby.
And that even means hot and humid conditions outside, isn't it?
But it's the same, think about it when you go outside on a really hot day. You don't feel that good, especially if you're exercising really hard. So you just have to remember your body as a pregnant person is a lot more at risk than even just non-pregnant. So you don't want to overheat. In the second and third trimester in the pregnancies, the overheating is a bit different. It tends to be because your blood pressure is lower, and your body tries to cool itself off by opening up your blood vessels, and that decreases your blood pressure more, so you're more at risk of things like fainting. So if you take a hot shower when you're pregnant especially, you can faint and hurt yourself.
And our blood pressure is already a bit lower, isn't it?
It's already a bit lower. So I think just, again, being reasonable and avoiding very hot activities all throughout the pregnancy is a safe thing to do.
Okay. Another question I get from moms all the time is, how hard is too hard and how easy is too easy? My moms who are taking my group fitness classes, and they get the best news of their lives that they're pregnant. But, and for me, you and I were buddies then, and you were telling me I needed to slow down when I was pregnant with Brooks, and I didn't want to hear it. So what is safe, and how do we tell how hard we're working?
Well, there's no generic answer for everybody, but I think it's all relative. Again, speak to your doctor about what's right for you. But I think, again, it's about modifying. And, you might be super strong at the moment, and you might think you can lift really heavy weights or go for big runs or do lots of jumping, and you probably can. But what you have to think about is what that's doing to your body for the future. So if you knew that in this pregnancy, if you did lots of running and lots of heavy jumping and lots of heavy lifting, it meant that after menopause, and so that's obviously after you finish your periods and you can't have babies anymore, it means that you're going to be incontinent of urine or feces, or have a prolapse where your internal organs...
In other words, you might be weeing or pooing yourself when you're 50, 60 years old, even if you don't experience symptoms right now. That was something that really spoke to me, that was like, okay, I need to think about the longevity.
Yeah, and so I think it's really important to make women aware of those types of things. I mean, I don't think anybody would want to jump now if it meant that they're going to pee themselves later.
Right.
So to me, that's a no-brainer, but I think it's important that we educate women so they know that doing these things in pregnancy can cause harm in the future.
So a lot of that has to do with high impact exercise, which we always show you, or for the most part anyway, show you a low impact modification to keep you from the jumping. And instead of doing really heavy weight, just go down in weight. Are there things that we can do to take a bit of pressure off of and it's our whole core canister too, right? It's not just our pelvic floor. We also risk the ab separation, which can lead to a big belly that's hard to stop bulging even after you've had the baby. And the heavy weights can impact that as well. However, if you sit down in a chair or on a stability ball, can you increase your weight a little bit?
Yeah. And so I think that's why it's important to do it under the supervision of someone like yourself who does a safe workout that's modified for pregnant people. And by changing your position, you can change the stress on your body and make it safer. So standing up can be a lot more risky than, say, sitting down for some exercises, or lying on your back versus lying on your side. So it's just important to modify. And then, of course, with modification and practice, and depending on how fit you are, you can lift a little bit heavier, or do a little bit of a harder or tougher exercise. But still, you just always have to be mindful that you don't hurt yourself, because again, nobody wants to get ab separation if they can avoid it, and nobody wants to destroy their pelvic floor if that's avoidable.
Right.
So again, it's just understanding the risks and making a safe decision for your body.
Listen to your body. We do have a big spectrum though of, some women, it's hard to get them off the couch to want to even go for a walk. Then you have other women who are going, I love these HIIT classes and F45 and CrossFit and boot camp and just, even the fun dancing classes that involve lots of jumping. That was me, and how do you know how hard to work and how hard is too hard? Let's talk a little bit about rate of perceived exertion rather than going off of heart rate.
Well, again, everybody's fitness level is different prior to pregnancy and during pregnancy. But I think if after you speak to your doctor, you can decide what level is good to start at for you. Someone like yourself is going to be quite different than someone that's always sitting on a couch, what we call the couch potato. Someone that doesn't do much exercise. But in terms of rate of perceived exertion, it's quite an easy scale, because again, everybody's perceived exertion is going to be different. But theoretically, what we want is moderate intensity exercise. And what that usually is for most people is that you can talk quite comfortably, but you couldn't sing without kind of losing your breath.
Right.
And so that's a pretty good gauge for most people, if we're talking the general population, to aim for moderate intensity.
So think about that when you're doing the workouts with me, with Strong Sexy Mamas. Just make sure you can always talk through it. Maybe you aren't able to get through all of singing Happy Birthday. If you were able to do that, then that would...
Not working hard enough.
Yeah, you're probably not working hard enough. You probably need to do a bit more, either get a little bit deeper in your squats or increase your weight just a little bit, or do more repetitions in a shorter amount of time, increase your speed or tempo. But you want to make sure that you can talk and you're not...
Well, that's right.
Too much.
That's right. And the other thing I think that's important to note is that everyone's different, pregnant or not. I have a bad back. I've had it for years. And so I do all my exercise low intensity, and I'm not pregnant anymore. And don't intend to be. I've had my kids. But I think it's really important to note that doesn't mean you get a bad workout because you're doing low intensity. So I think you just need to listen to your body, whether that's a pregnant or non-pregnant body, and then be guided by safe exercises like your program. And you can still get a really awesome workout doing low intensity.
Of course you can.
Or sorry, I should say low impact, not low intensity.
Right. Moderate intensity.
Moderate intensity, low impact can still be an awesome workout.
Yes, and we'll go over the differences in that in another chat. But you saw me go, what about if you are getting breathless? Because I think about, as my belly started getting bigger, I was getting puffed just walking up these stairs right here. But there wasn't anything wrong with me. Also, when I'm teaching my real-time workouts, which are pretty much live almost in the backyard, I'm using even lighter weights than I would if I was working out just on my own, because I need to be able to talk all of you ladies through the workouts. How do you know when breathlessness is a problem and when you need to talk to your doctor about it?
Well, I think if you're worried and you're concerned enough to think, is this normal, then talk to your doctor. That's first and foremost.
Okay.
Second of all, in the third trimester specifically, breathlessness is quite normal. But normal for a pregnant person. So what I mean by that is, as your uterus gets bigger, it's actually squashing your diaphragm, which is the muscle that controls breathing.
Up here,
and
right.
actually, and your lungs are actually squashed by about 4 centimeters. So, it's quite a bit. So there's actually a physically less space. That's why you're breathless. That's the most common reason. And that's physiological. It means it's not wrong. Like, that happens to everyone. And so if you're just breathless because of that, then that's still a safe thing. But you may feel breathless, and it's important to talk to someone about it. Some other types of breathlessness that are more of a worry, which perhaps people don't know, is that if you have a lung disease like asthma, that might be worth talking to your doctor about. Maybe you don't know you have asthma. Anemia, that's another big one. So it's really common to become iron deficient and sometimes anemic in pregnancy. One of the signs of more severe anemia is breathlessness. So that's a really important thing, especially in second and third trimester, where you can become anemic.
Yeah.
That's where your blood count gets too low and you can get really tired and have no energy.
I had to have an iron infusion when I was pregnant with Brooks from my levels getting so low.
So that's a sign, and that's what I'm saying. If you do think your breathlessness is either getting worse or you just feel a bit uncomfortable with it, talk to your doctor. That's the safest thing to do.
I just want to get back real quickly to the rate of perceived exertion and rather than heart rate, because there are old recommendations that you'll probably find online about a certain BPM, beats per minute, that you should keep, and you can watch your heart rate monitor, and that's how you know whether you're working hard enough or not working hard enough. And that's actually an outdated idea, isn't it?
Yeah.
Why is that?
Well, because in general, your circulatory system is different when you're pregnant, and that's for a lot of reasons. But essentially, in a nutshell, everyone's different. Your heart rate tends to go up when you're at rest, or in general, and your blood pressure tends to go down. And those things can affect how you exercise. So most exercise used to be based on a percentage of maximum heart rate. Well, if your your resting heart rate is already higher, that's going to skew looking at the percentages of maximum heart rate based on whether it's low, medium, or high intensity. Mm-hmm. So already it's not an appropriate measure for a pregnant person. It can still be used for non-pregnant people, but I think rate of perceived exertion is a much better way to deal with it. And that also speaks to fitness. So if I'm not as fit as Anna, which I'm probably not, my rate of perceived exertion, I'm going to struggle to talk more quickly than she will. And so I think that's good, because that'll be moderate intensity for me.
You.
And moderate intensity for her will be at a higher rate of perceived exertion, if that makes sense. So it really depends on you individually and how fit you are and how your circulatory system responds to your pregnancy and your level of exercise.
Another thing you'll see all over the internet as far as pregnancy guidelines is just stay off your back. Anything that you do on your back is a bad idea. But ACOG, which is really the gold standard, has said just avoid it for long periods of time. So exercising on your back for a couple of minutes at a time is fine, you say?
Yeah, so again, it's about what happens in your body and your physiology when you're pregnant. As your wombs or your uterus starts to increase in size, already the return of your venous return, so the fluid goes around your body and then it needs to come back to your heart to get reoxygenated. Already based on the size of the uterus, you're pretty much, and gravity, you're pretty much having bad venous return from your legs and your lower body anyway. Yeah. And so theoretically, if you lie on your back, you're blocking that venous return more. So that's where that came from.
Yeah, the weight of the baby, the weight of the uterus.
Correct.
Stopping the blood flow, and that wouldn't be good for mom or baby.
Right.
However, a couple minutes at a time.
Right, everybody's different. So if you feel well on your back, then it's perfectly safe to stay for 2-3 minutes, 5 minutes on your back. If you don't feel well on your back, then don't stay on your back.
Right.
Then you can modify. And again, that's about seeing how you feel, watching how you feel. And if you have a medical condition that the doctor says to you, you shouldn't lie on your back, well, then you listen to that as well.
And take a look at the prenatal core workouts. Yeah. There are at least 3 in there. And I show you how to modify if you are uncomfortable on your back. Because there are a lot of great exercises we can do on our back for our abdominal muscles, for our whole core, for our pelvic floor, for our glutes, our multifidus. And I'll show you how on a stability ball, you can use that to get yourself on an angle or an exercise bench, prop yourself up with pillows. There are ways if you're feeling uncomfortable. Again, you just have to be in tune with what's going on, right?
Yeah, I mean, you don't want to hurt yourself. So whatever way you need to modify for you, if you feel like an exercise is not working or you don't feel right, ask a question, get support, talk to someone who knows. That's why it's better to always do pregnancy specific or prenatal exercise.
Yeah, and you do see that online a lot as well. Prenatal or yoga and Pilates are great for prenatal women. Well, they're great for prenatal women if they're prenatal yoga and prenatal Pilates, but not just in a generic Pilates or a generic yoga, right? That can be very bad. There are a lot of exercises that can actually harm you.
Yeah, and so I think that's key. It's not just being very general about don't lie on your back or, don't do crunches. Well, okay, but it's really more specific about certain positions of the hips aren't good, certain positions with your back aren't good.
Right.
So what's important is that you get guidance from someone who's an expert, like Anna, in prenatal fitness, or whether you do a yoga or a Pilates class, like we've talked about, it's really better to get pregnancy specific,
right,
because they should be modified correctly.
And in a group setting, if 14 out of 15 women are not pregnant, then it's hard as an instructor to go around and make sure that you have modifications for everyone. Mm-hmm. So just go to, if you're not doing a strong sexy mamas workout with me, which I hope you are, but if you are going to a prenatal or to a yoga or Pilates class, make sure it's prenatal or postnatal specific. Let's talk about core exercises, because this is where, look, I wish that this was the only place that I was gaining weight. I'm definitely softer everywhere, and that's normal. But this is where, the boobies too. I meant to go like that, but there too. This is where most of the magic is happening. And we do need to be very cognizant of our core. A lot of instructors and trainers in the basic training, you don't get loads of prenatal and postnatal education, which I wish there was more. The specialization certifications like I've got, you do, and we do talk a lot about the core. Why is it important to continue working the core rather than just ignoring it? Because that's another thing a lot of trainers do, is they just go, I don't know what to do with that part of the body, so I'm just going to stay away from that.
Yeah, that's right. Well, importantly, yes, your physiology is changed, your anatomy is changed. Your muscles spread out and they don't work as effectively, because when muscles are on too much stretch, they don't contract. And so someone needs to be aware of that. So that's why doing things like crunches are a bit useless. Aside from hurting yourself, you also can't really do a crunch properly, because there's
now my abs are out here, aren't
that's
they?
right.
They're
you have no
here.
abs in the front. And that's technically the typical crunch exercise. So that's not appropriate for a woman in a stage of pregnancy. However, you have plenty of other muscles in there which need to be worked. So it's important to be aware of, like transverses, they're still on the side, your lower back muscles, your pelvic floor. Mm-hmm. These are things that need to be worked. And they're still intact mostly normal as well in terms of anatomy. They just need to be worked in a safe manner rather than being ignored.
So we really focus on the transverse abdominis, which is our innermost corset muscles, we say. How will working our core, our pelvic floor, which is part of the core, how will that help us during childbirth if we're having a vaginal delivery in particular?
Yeah, well, look, I've been through two myself. They're not a piece of cake. The outcome is amazing, but in general, the more in shape you are prior to your labor and delivery, I can't promise you this means you're going to have an easy time, but it certainly prepares you mentally and physically. It's the same thing. You have to look at it as a big event. If you were, now, not that I'm advising doing a marathon in pregnancy, I'm just talking about in general. If you're preparing for a marathon, you train for it. You exercise, you have a plan, you make sure your muscles are strong, you're mentally and physically prepared. Birth is no different. Birth is a big event physically on your body. So the more strong you are, the more supple you are, the more prepared you are, the better your muscles are going to deal with that labor and delivery. And you are going to get injury, so in that way that can't be helped. There is injury whether you have a cesarean or you have a vaginal birth, there's injury to your muscles and to your pelvic floor and to your abdominal wall, and that's inevitable. But what we can do is prepare you for that anticipated injury, so that, and it's the same like if you're rehabbing an ACL tear or a ligament tear in your knee. The people that do the better have been shown the more they exercise and are fit prior to the surgery, they recover so much more quickly. Birth is no different.
What about the transverse abdominis in particular for helping us to guide the baby out?
Sure. Well, so if you look at gravity, or where the baby has to come out, that head needs to go down that way. And you may not have muscles in the front, but you certainly have muscles on the side. And the transversus abdominis can help you push, along with your very strong uterus, can help you guide that baby in the right direction.
Right.
So again, just being physically prepared with strong and strong muscles is a really good way to make your birth experience better.
And while we're talking about core, let's talk about the pelvic floor. A lot of people don't put those two things together. I think that's another way that the fitness industry is kind of often neglecting women in prenatal and postnatal women in particular with the pelvic floor. But if we have a strong connection before we've had our baby, we're more likely to get that back as well. The brain-body connection between the pelvic floor and our tummy muscles too is kind of broken a little bit. It's not broken that can't be fixed, though, is it?
No, and I think first of all, awareness. I think it was taboo for a long time, and it still is a little bit. People don't like to talk about it. You need to talk about the pelvic floor. The pelvic floor is where
I'm on a mission to talk about it.
I know, it's where the baby comes out.
It's so natural.
It's so natural. We've just been afraid to talk about it for years. In the same way that we really need to make it normal that women can experience incontinence. That's bowel or bladder. So that's poo and pee. You can also have prolapses and things where...
And what's a prolapse?
So prolapse is where, there's grades of it, but prolapse is where parts of your anatomy or parts of like your uterus or your vagina collapses. It can actually come all the way out of your body, which is very traumatic for mothers. And sometimes needs to be repaired surgically. But you can get grades of that, and just a little prolapse after having a after being pregnant for 9 months and then going through vaginal delivery can make that happen, and people need to be aware of that possibility. So again, going back to the pelvic floor, the more strong your pelvic floor is prior to going through that birth, labor and delivery, the more likely you are to be able to reconnect with it after your birth, help it to heal, give it the opportunity to heal, I should say, and then reestablish that brain-body connection, which is hard. I personally found that took months after having a baby, just learning how to tell my body to contract those muscles. So I think the earlier we start in pregnancy, or even before getting pregnant, learning about pelvic floor, learning about working on pelvic floor, it's crucial.
There are so many different things out there you can do for your pelvic floor too. And in my classes, I do incorporate it into almost every single one. And the way I like to instruct women, and I want to hear what you have to say, but I'll tell everyone to imagine that there's a diamond down below and we're trying to draw our pubic bone and our coccyx and our sits bones together, but also up in the front and the back. So it's both sphincters. It sounds lovely, doesn't it? What is it that you tell your clients when they come in and they go, I can't, some postnatal women actually tell me, I can't even feel my pelvic floor anymore. It's very sad. Or they'll accidentally be doing something with their hips or their glutes or their quadriceps. How do you encourage women to activate the correct muscles?
Well, probably one of the easiest things. So people that are less body aware, that haven't practiced pelvic floor, everybody poos and pees every day. So that's probably the easiest way to get people to understand. And so the best way to practice, especially if you can't feel it or you haven't done anything like that before, is to try and just gently squeeze your stream off as you're peeing, just to get the sensation of where those muscles are, what's controlling that. And you can do it when you're pooing. It's a little bit harder, but you can do that as well. That's just to learn where those sphincters are, because those sphincters control the contractions and control how you evacuate what you need to get rid of.
So that's how we know that we're actually activating the correct area of the body, but we don't want to get in the habit of trying to stop our pee and poo every time we're on the toilet or anything. That's just letting us know where they are and how to activate them.
Doing that, you can hurt yourself as well, so you have to be really careful. But I think the important point is, if you don't know where your pelvic floor is, to learn about it. If you gently start to do that, you'll start to think, oh, that's the area I need to work. And then once you know where it is and you can sort of feel it, then you start doing the exercises, which is whenever you think about it. Making a cup of tea, cleaning a bottle, feeding your baby. Oh, my pelvic floor.
You can go for the rest of this interview. We're almost done. How about that? In fact, is an area in your library too that I think I call 12 tips to activate your pelvic floor, something along those lines, that is very beneficial, and lots of moms have said that was really helpful. So make sure you look at that as well. I'm trying to think what else we need to go over. I know nutrition and water intake is so important for prenatal women. Can you just bare bones, nutshell, give us an idea of some of the foods we need to be eating, our nutrients?
Well, I think it's important to mention the things that you shouldn't be deficient in. And so this is important discussion with your doctor, even prior, or nutritionist, dietitian prior to pregnancy. So things like making sure you have enough folic acid, enough iron, enough fish oil, and enough iodine. And most prenatal vitamins or pregnancy vitamins now have those in them. And just even taking that in the correct amounts will help you through the pregnancy. So we don't always advocate taking supplements in other times of our life, but in pregnancy we do. Because we know, for example, folic acid is one of the clearest ones. If you take folic acid, and that goes everywhere around the world, and there's programs everywhere, we can prevent spina bifida. Who wouldn't want to do that, right? So, and then when you're talking about being pregnant, if you can keep taking your vitamin, that's good. But then you would just want to talk about regular principles of healthy nutrition. It's really easy to get constipated when you're pregnant and after delivery. So making sure to keep up your water intake, increasing your fiber. So again, lots of fruits and veggies are really important. And just, if I didn't say it, drinking water is super important. And exercise can help with constipation as well. So there you go.
Another benefit.
What else? So, and just trying to make sure to not have too many sweets. I mean, again, you get cravings when you're pregnant. If you crave chocolate, eat a piece of chocolate. You know, I think it's important not to deprive yourself. But if you don't want to gain, so we should be gaining between 12 and 15 kilos, which I think is about 30 pounds.
25 to 30 pounds.
That's a safe amount. You don't want to get 100. You know, a lot of people think it's okay because I'm pregnant. No, that's not healthy for you because it puts you more at risk of things like gestational diabetes, high blood pressure, and some other things in pregnancy, and being overweight and obesity. So we do need to be, of course, deal with your emotions, and if you want to have a piece of chocolate, have a piece of chocolate, but you don't want to only be eating fast food, sweets, ice cream, cookies all day long.
It doesn't make you feel good anyway, and then you don't sleep as well if you're eating it properly.
Make a mood crash.
And if we want to avoid stretch marks, I've got a couple right here that have just popped up in the last few days, unfortunately. But, we want to limit our weight gain for for aesthetic purposes too, right?
Yeah. So I'll be honest with you, there's no evidence that anything decreases stretch marks, except you put a very good point out there. What's the number one cause of stretch marks? It's weight gain in a quick pace. And so getting obese is a surefire way to get stretch marks. So there you go. Nobody wants stretch marks.
Right.
You can't prevent them if they're going to happen, but certainly gaining too much weight puts you at risk of getting them. And so even another reason not to.
And we will go over more postnatal tips in due time, because this little girl's on her way out pretty soon. Separation or diastasis recti is something that a lot of people are starting to hear a lot more about. Maybe you've heard of it, maybe you haven't. The majority of pregnant women have a bit of ab separation by the time we give birth, don't we?
Yeah, it's very common. It's not talked about, but like you said, it's becoming more known, which is great. But look, I mean, you can see Anna's tummy. The baby grows so big that your abs just can't control it anymore.
Yeah.
They can't stay together. It's just physiology. And so what happens is, as the tummy expands, the abs go out to the side. And again, everybody's a different degree. Some people get a really big separation where actually the muscle rips or tears, and that can cause a lot of issues in the future. And some people just get a little mild separation. Everyone's different. You can get it assessed properly by a physiotherapist. Someone specific for pregnancy is best. And then base your exercise program or rehabilitation afterwards, depending on how bad your separation is.
There are exercises that we can do during pregnancy that can encourage the muscles to stay somewhat more together, and exercises that we can do that can make it worse. Jumping is one thing. We have to remember that all of this, everything's connected, right? So if you could talk a little bit about why we don't want to be doing full plank, push-ups, mountain climbers, big jumps, plyometrics.
Well, any of those things you're talking about, high impact or heavy weights, what they do is they increase the pressure inside our abdomen and our rib cage. And what that does is, pressure is always trying to equalize itself. Too much pressure inside is trying to get out. Too much pressure outside is trying to get in. I mean, that's an oversimplified physics, but that's essentially what happens. So if you increase the pressure inside, it's trying to get out. And what happens is normally, so for example, my tummy's not that flat, but it's flat. It's flatter than when I had babies. And my abs are more in alignment here. So if I increase pressure by lifting a heavy weight, my abs are going to be able to deal with it. They're going to hold that in. looking at Anna's tummy, which is a very pregnant 9-month tummy, she's very fit, different than someone who's very obese and pregnant, but she's going to have a certain amount of strength to be able to hold that pressure in. But let's say if you're very obese and pregnant and you try to do heavy impact exercise or heavy lifting, you're going to hurt yourself. You will rip that, the rectus, among other things. You're going to maybe increase your chance of getting pelvic floor damage. So you really have to be very mindful about bracing yourself, trying to limit the amount of weight you gain in pregnancy over and above what's normal, and trying to do those exercises that you talk about so often that are not safe.
And you don't have to be obese though to get this at all. I have plenty of women in my classes, postnatal women, who they're this big, but they've got 3 fingers of ab separation, and they're going to see a women's health physical therapist to try to encourage those tummy muscles to go back together, and are really having to watch what they do. Things that increase your risk of more severe diastasis recti, multiple babies, right? Or having them in a short amount of time. What else?
And things like we said before. So I think it's quite right. The more babies you have in a short amount of time puts you at risk, because you don't have time to go back to normal or go back to mostly normal. Again, gaining too much weight can do it. And doing those high impact things like planking, sit-ups, high impact, super heavy weights, lots of jumping, any of those sort of more dangerous activities, that's all stuff that puts you at risk. Even if you do everything perfectly, it's still possible to get it. So I think that's important to note as well.
I know all the things, you know all the things, and we both still have a little bit after one, and after the second baby, I'll probably have a little bit more than the first, and if we have a third, it'll probably be a little bit more. But there are things that you can do in the postnatal period, which is another reason for you to go to Strong Sexy Mamas and do your core foundations workouts before building on. It doesn't mean you can never do sit-ups again. It doesn't mean you can never do planks again. No. You should, more than likely. But you need to set that foundation first, don't you?
You set the foundation once you're ready to start exercising after pregnancy, and then in a stepwise fashion, safely, again, like doing a program like yours, you can get back to those things naturally with time.
And if you do have diastasis recti, it can also often mean that you have a weak pelvic floor, so you might have more incontinence issues. You could potentially have back pain, and if it's really bad, you can even get a hernia down the middle.
I mean, these things are more uncommon, but you could definitely have that. And in general,
or just a bulging belly. You just, if you can't help it, if there's a distance here, or the integrity of the fascia, which is really important as well. It's like, a bit of spandex right here. You eat a big salad.
Yeah, so another example, exactly. Another thing that happens as we get older as women and go through menopause, all of the muscle tone decreases. We tend to gain weight, even if we're fit. And so those things, if you have a weak abdominal muscles, you can pooch out, even if you don't want to. It just happens with our bodies. And so again, just prevention is key. Do your best to be strong and fit and healthy, and try and prevent these things if you can.
Yes.
And then if it happens to you anyway, that's okay. That's still normal, can be normal. Get help. Get help to rehabilitate it like you would any other injury.
And some other injuries, common injuries or aches and pains, things that you might be dealing with during pregnancy that I do often mention in the Strong Sexy Mamas workouts, but you ought to take things a step further and go see your medical healthcare provider, talk to them one-on-one. A lot of strengthening and stretching exercises I do can help, but there are some things, pelvic pubic pain, a lateral movement might be too much for a mom. Carpal tunnel, there are things you can do. I'll have you do push-ups using weights instead, for example, or have your wrist like this instead of flexed backwards that way. But what are some other issues that moms need to be aware of and that should talk to their doctor about?
So like Anna said, if you have pains that are severe, definitely it's not normal and you need to talk to your doctor. Some pain can be normal, but again, most women get a little bit anxious if they have pain. So again, always talk to your doctor. But you can get something called round ligament pain, which is quite common.
Oh, yeah.
Or growing pains, as you would. As things spread out and grow and the uterus expands, different things are being stretched, different hormones like relaxin are making your pelvis more lax, and this puts strain on your ligaments. It's not always pathological in the sense that there's something gravely wrong, but certainly it's worth noting that you can have aches and pains as you grow and expand and your hormones change in pregnancy. But again, always with the proviso that you check with your physiotherapist or doctor if you're worried. Carpal tunnel is very common as well. You mentioned that. There's a lot of reasons why women get that. And again, you could be predisposed to it. Carpal tunnel is a little nerve that runs through the wrist channel, and you've got a bunch of tendons and things that go in there. So depending on how much space you have in that tunnel is different for everybody. That's just anatomy. That's
Hands
how we
might start falling asleep.
Yeah, exactly. But then as we gain weight in pregnancy and as we have more swelling in late pregnancy, and that happens to all of us, that's our hormones that do that, that can make carpal tunnel worse. And most of the time we can manage it by position, or sometimes people get splints, doing exercises, avoiding exercises, like in a good program like Anna's. But again, if you feel like your hands are numb or you have lots of pain, then you should definitely see your doctor or physio about that.
Okay, yeah. In fact, after Brooks was born, I can't remember if I had it at the end of my pregnancy, but I had to get a cortisone shot at some point to give me some relief because my hand was falling asleep all the time, both hands, but one was worse than the other. This body is doing all kinds of crazy things that I can't control right now.
It's actually really amazing.
It's so amazing.
All the things that your body does. It just blows my mind.
Yeah. Well, Dr. Gamberg, thank you so much. You are just a wealth of information. You always spit it out in a way that we can all understand. So thank you so much.
It's such a pleasure always.
And you can find her. She's got a great website with information there that you want to follow, some blog content and things at drjillgamberg.com. Also check her out on Instagram. Thank you so much.
Anna.
Thank you. And have you ever used Strong Sexy Mamas, and will you ever use it in the future?
Oh, it's amazing. I may not be pregnant anymore, or had it when I was pregnant, but as a woman down the track who's got 8 and 10-year-old girls, I think Strong Sexy Mamas is an excellent workout for any woman who's either been through pregnancy or thinking of pregnancy or recovering from pregnancy.
Yeah, well, that's what I always tell people too. It's not just prenatal and postnatal women. Just what makes us special is that we have prenatal and postnatal modifications, but that the workouts are for all women and just designed for female specific reasons. We've got some areas that need some extra love and attention, don't we?
We do.
All right, Dr. Gamberg, thanks so much.
Thank you.
I think Strong Sexy Mamas has a great philosophy and a really strong message behind it. It's about confidence. Having a baby really takes its toll on you mentally, socially, physically, and I think having a group of like-minded mums working out with you is really good at helping rebuild all of that.
I'm feeling good, feeling strong, I'm feeling fit, I'm feeling energized, and yeah, classes with Anna have been awesome, keeping me on track through my pregnancy, and I feel as good as I've ever felt. It keeps me limber, it keeps everything moving. If things don't feel good, then Anna's always got a modification for me, which is great. But I just like to feel like myself and like to feel as fit as I can, so this is the best thing for it.
It's an amazing class. I love Anna's class. It's so much energy, and it's in such a beautiful setting at Bondi Beach. You can't get better than this. You will feel sexy and strong after the class. It's great.
I love that Strong Sexy Mamas comes online, and it's those short 15 minutes, 20 minutes. And I have 2 toddlers, a 1 and 2-year-old, and there is no way I can get to any of those mums and bubs classes anymore. 15 minutes, I can totally squeeze into my day. I can let them run amok, let chaos happen, and they even get involved, get in the way, and then, 15 minutes I'm done, and I'm back cleaning up after them.
Getting out of bed in the morning to actually go and do some exercise has probably kept me sane. Having a baby who doesn't sleep and is not on solids at the moment, who's breastfeeding, it does take its toll. So getting out and being able to be active and obviously join, an amazing community of girls, it's really empowering.
I like working out with Anna and Strong Sexy Mamas because I struggle to motivate myself at home just with having a 14-month-old baby, and I've had a few injuries, and these exercises in particular go at different levels, so I can do the kind of lower exercises as opposed to all the jumping and things like that, and it's helped me to get back motivated again.
I love Strong Sexy Mamas because it's so important to do exercise in a safe and controlled way after having a baby. It takes such a toll on your body, and Anna is amazing at giving options. It's a long recovery, and she's been amazing at helping me progress through different movements as we're going on our postnatal journey.
I love working out with Anna and the Strong Sexy Mamas. I'm having baby number 2, so I've been doing the Strong Sexy Mamas program when I had my first one, which was 19 months ago. And it's just been great that I've been able to use the program throughout the pregnancy and then after my pregnancy. And it's made me feel stronger being pregnant a second time round as well. I feel like my core is better, my glutes are better, and you need so much more energy with the second baby. So I feel like Strong Sexy Mamas has really helped me.
You can do it from home. Everyone knows babies can be difficult sometimes, so to be able to work out in your house, in your home, and include the baby in it, I think is absolutely amazing. Cost effective, I mean, look guys, we're not working, are we? Not everyone has loads of money, so to be able to just jump online, watch a video and work out with your bub at home and get fit again, I think is such an amazing program. It's also starting to teach them about an active lifestyle. They might be young, they might not know a lot about what's going on, but I think it's really good to start that active learning in their brain from an early age.
Pelvic floor's always been such a taboo topic, and I don't think it should be. We've all got one. We're all going through the same thing once we have a baby, and I think it really needs to be out there in the environment for everyone to know, but for everyone to understand as well how important it is to you as you get older once you've had your babies.
The postnatal workouts that we do are so important in the way that women's bodies recover. That is not talked about enough, not dealt with enough. Everyone launches themselves right back in, and I like to think about that first period as almost a 4th trimester of pregnancy, and paying attention to the pelvic floor, being able to find workouts like yours that are fun, being able to involve the baby, but don't forget about what our bodies are recovering from, and being able to feel comfortable taking it really slowly so we can get fit faster in the end, but taking it slowly to find a class that does that and pays attention has been amazing.
I love Strong Sexy Mamas because it gives you the opportunity to work out at home when you're too busy and have a hectic lifestyle and you can't make it to the gym. And Anna has amazing energy and her programs are super easy to follow.
I love Strong Sexy Mamas because it makes me feel good, and I encourage all women to do it, all mummies to do it, because if you feel good, then Bub's going to feel good and everyone's going to feel good and the world's a better place. I love how energetic they are and they get a full body workout, and because I've had a cesarean, I get the option of doing some low impact, and then later on I'll be able to do some high impact, and they're just so versatile, and really it's about fun for me and getting my body back to where it was pre-baby.
I love Strong Sexy Mamas because of the online videos. They're easy to do at home with your little ones running around, and there's lots of choices you can do.
I was like, wow, this is for me. And so the belly's going and getting strength in my arms, and with strength comes just greater confidence. I just feel really good in my skin at the moment, and I love that.
What is it that you like about taking my classes?
Well, first of all, it's awesome fun. Smile from ear to ear when you're doing it.
It is fun. So you would recommend it?
Absolutely try out her class. It is super fun and really safe and well done and thought out, and I think that it's a really great class.
Oh, thank you.
I like also the fact that you offer lots of options. So, for example, postnatal women need to take it a bit more easy, but even someone like myself who's not postnatal anymore, my kids are 6 and 8 now, but I might have other issues. I've got a sore back, so I don't do high impact exercise in general.
Yeah.
And I like that you offer options.
But she is always working it, doing the low impact exercises.
That's right. Just because it's low impact doesn't mean it's not hard work. It doesn't mean that you can't sweat or you can't get a good burn or good pump, a good exercise, challenge your cardiovascular system, strengthen those muscles. But I love that you give options.
Yeah. Absolutely, I would definitely recommend Strong Sexy Mamas. It's been great to meet other like-minded mums. It's been great bonding for Valentina and I really feel a change in my body already.